Hi, my name is Kerry Dault, and I am the Program Manager for Crisis Services CMHA Simcoe County Branch. I have been with the program for about 15 years, and CMHA Simcoe County Branch offers a wide array of services and programs related to mental health and addictions. One of the programs, which is the one I manage, is the Crisis Program. We have been partnering with police in the area for over 10 years to provide mental health support and services in the community with police side by side. After a couple very successful pilot projects with Barrie Police, we were able to obtain permanent funding from the ministry, and every year we have annualized funding from the Ministry of Health. In 2018, we implemented a full-time permanent COAST program. COAST stands for Crisis Outreach and Support Team, and we are currently partnering with Barrie City Police, South Simcoe Police, and Aurelia OPP to do that work. Our COAST teams are activated through 911 calls for service. They are also activated by referral from other uniformed officers who feel that COAST would be a good idea to meet with someone in the community that may be difficult to engage. We also refer to COAST through our 24/7 crisis line, who receive community crises and inquiries, and the team there determines whether or not this is something that a COAST team should go to attend to, or if it's something that can be looked after within the program.
Hello, my name is Crystal, and I am the mental health crisis worker with the COAST team here in Barrie that's partnered with the Barrie Police. So on any given day, we respond to live 911 calls for individuals experiencing acute mental health crisis. And we also provide follow-ups in the community and we get those from officers that have responded to calls prior, but feel that COAST involvement may enhance somebody's life. So we also offer that service as well. And we also do get referrals from the 24-hour, 7-day-a-week crisis line through CMHA when they feel that somebody could use our assistance to either de-escalate a crisis or to connect them with other services throughout Barrie that might be beneficial for their mental health. Yes, so I am primarily with my one officer, and we travel in a inconspicuous van because we like to be not easily noticeable. It kind of decreases the attention that the police may bring to somebody. So it's more of a client-centered focused lens to take that attention off of somebody.
So the primary role of the COAST teams are to respond to calls for service in the community, to provide crisis intervention, de-escalation, connection to services that are more appropriate, and help someone navigate the system if they are in a crisis and they are unable to do that for whatever the reasons are. They also initiate intervention with difficult populations, so there may be some people that are difficult to reach through traditional methods, so perhaps they have difficulty using a phone, or perhaps they have difficulty walking to an office, and the COAST teams do engage with people that are perhaps more difficult to engage in services. So some of the objectives and the outcomes in having a COAST team in the community is that they divert from unnecessary visits to emergency rooms. So lots of people at times, if they're in crisis, they feel going to the hospital is the first step, when in reality there's lots of other community services that may be able to really help them before they get to that stage. COAST teams also help divert 911 calls, so meaning if somebody is used to calling 911, now they have services in place because they've been connected, so that reduces the level of 911 calls, the level of need for uniformed officers to attend calls to the same person, because now they're being served in a better way. COAST teams also assist in the community. They collaborate, they do consultation, they assist other community members and other stakeholders to help them provide more comprehensive service as well.
So one of the really great things about COAST is that we work with the community in the community, and we try to remove some barriers for individuals that have trouble accessing community service, or maybe they're not even aware of community services. Another great aspect of COAST is that there's an ability to free up the frontline officers to attend other calls, because mental health calls can take quite some time, as we have no time restrictions, and we want to spend time with the people and hear their stories, hear what's going on with them, so we can help better meet those needs that are missing. For an example, we had a call to an individual that was really struggling with many different areas of their life. During that call, we were able to free up many of the officers from this individual and hang behind. And we were able to connect this client with many different programs throughout CMHA. And it turned out to be a success story because this individual was struggling with housing, with financial constraints, also with their mental health being untreated because they did not have a doctor in the area to get their medication, and also some interpersonal relationship struggles. And so a couple months ago, we were notified that this person is now happy and thriving within the community.
I'm Scott, I'm with Barrie Police. I am part of the Coast team, the Coast program. I work alongside with CMHA. As part of my role, we attend various calls for service, particularly with our frontline officers. Also do follow-ups from frontline officers. So what I've actually learned through this role and through the process is the relationships with CMHA and the community partners in which we work with and how important they are. The education and the knowledge that I've gained through Crystal and through CMHA has allowed me to be a better officer to the community and the various programs that I was never aware of before I started this role. It works well, and it is a very huge benefit to our frontline officers who can depend on a professional such as Crystal to be able to come to calls for service that require her professional outlook and opinion. It also helps to keep people out of the hospital and direct it into other community supports and resources.
The Coast teams also assist police in determining whether or not somebody should be apprehended or if they can better be served in a different way. Coast teams help to do risk and mental health assessments. They provide safety planning procedures. There is hope to be a reduction in the number of apprehensions that are not necessary for people, which means individuals that are in crisis in the community have less involvement with police, less involvement at the hospital, less involvement in potentially higher risk situations or use of force.
Our approach is a little different. Obviously, I don't wear a uniform, so I'm a little bit more approachable than coming in with a uniform on. That's one thing I've found since doing this, we're being put in this role. I think even just with us, we're one team. We could probably use another one for the city. I regularly get officers on the front line wanting a dedicated Coast team per platoon that would follow the platoons. Obviously, that's something that could look at down the road, but the feedback I get from frontline is that this is a very, very, very important program for both the police and for the community, as well as for CMHA.
Working together in a partnership with the Barrie Police Service allows for a mental health worker to respond imminently to a 911 call, which can quickly de-escalate the situation, and it can also get them connected with appropriate resources. Being able to recognize mental health symptoms and understand what's happening and what's going on. Sometimes we're able to divert away from the hospital because that's not always the best treatment, and we're able to get them connected in many different services for a longer period of time. So their care is increased by the connection that we're able to make within the community.
So what I found over time is when we get calls for service come in, more and more we're getting people actually requesting Coast to attend rather than uniform. So I'm finding that as time has progressed, while I've been in this position for about a year, as the months have gone by, I find more and more calls for service that are coming in. People are requesting that we attend rather than uniform.
So as Coast is not a 24-hour service, and we know that mental health crisis can happen at any given time for any reason, I would encourage anybody struggling and that needs to talk to a professional to utilize the CMHA mental health crisis line that is available 24 hours a day, 7 days a week with trained professionals.